And so when I heard this news today, I have to say that it only delighted me in such an incredible capacity because of the fact that this is necessary for us to be able to continue to better treat our children and adolescents who have narcolepsy. Specifically, I would say that this really resonated very strongly for me because an approval of an Oxybate is actually what led to me developing my interest and focus within narcolepsy. When I was a fellow, this was when there was the initial studies done with a twice nightly sodium oxybate in pediatrics, which led to the initial approval for use of oxybates in children. Since that time, we still continue to have a limited landscape. We most recently saw a new alerting agent with pitolisant getting a pediatric approval for excessive daytime sleepiness, but now having a once nightly sodium oxybate being available only allows me to treat more patients more effectively. And this really has been just a monumental day because we're now continuing to move the needle to really treat every patient, not just some. One other thing that's fabulous around the consideration of now having a once nightly sodium oxybate available for treatment in pediatrics is that although the once nightly sodium oxybate is the newest formulation available, we have over 20 years experience of utilizing oxybate medications in various forms for the treatment of this condition. And therefore, we also have tremendous experience in regards to its safety profile and generally what we see as dose-related side effects. Most commonly, we're going to encounter side effects when we first start the medication because your body is undergoing a shock. It is a new medication that you're experiencing and your body is giving a response to it. Most commonly, things that you'll see are people describing, maybe I might have some nausea, potentially vomiting. I would say that that's less common. The nausea, though, definitely can. But people will feel drowsy, and therefore they will describe potentially a drug effect. Most typically, what we're finding is that you see most people are going to have that side effect with first start. But similar to all oxybates, we tend to see as you're titrating over time, you may see a reemergence of side effect, and given enough time, we then see it reduce again. When we look at any of the clinical trials and even the clinical trials from the adult side, this was a pattern that was seen, and this was utilizing a forced titration model, meaning that we don't allow for you to have any time to improve if you're supposed to need to change today. And with that, you still saw the minority of patients discontinuing from this trial because of side effects. And many times these are side effects in clinical practice, whether it's nausea or headache or any of these, that you're able to navigate because you're able to inform and anticipate and then give strategies around what you can do. What I would say is that many times people have concerns about whether they're going to have to wake up for another dose or what if they need to wake up. And these are, again, all pieces that you can speak through in regards to what is the best strategy for you today. The introduction of having a once nightly oxybate, especially in a pediatric population, may provide meaning for not only the child, but potentially the whole family. Many times it is the parent who is navigating making sure they're waking up for that second dose. So sometimes that once nightly oxybate can be restorative not only for that child, but for the entire family. And so we are seeing that although this is a medication that you take at night and that people will fall asleep with it, its FDA indication is for daytime symptoms, excessive daytime sleepiness, and cataplexy. And so with that, it does introduce the opportunity to not only be able to treat narcolepsy type 1, but also narcolepsy type 2. And so as we're seeing these continuing number of treatments becoming available, there is no one size fits all. It's the matter of the approach of saying, which oxybate is going to be best for you? Is it an oxybate at all? Or perhaps we're utilizing other strategies. I think that the major win that occurs today is that it allows for us to really take advantage of the fact that there are 3 different formulations of oxybates, and now having a new one where we don't necessarily have to redose may provide treatments for patients who otherwise weren't successful or unwilling to consider other forms of oxybates. I think we need to be able to ensure that when providing different treatment options, that we really are evaluating what are the personal experiences and journeys, and then being able to tailor that therapy to the individual who's in front of us. So I think one thing that is really important when considering the approval of this medication is that many times the medication may be stigmatized as one, it's a big medication or it's potentially dangerous. When we look at the landscape of the medications that are available, they're mainly all controlled substances that each have their own profiles of risk and benefit. One of the things that I do think is further stigmatized, specifically with the Oxybate family of medications, is this thought of we reserve this medication for the person who is most severe. What I would say is the call to action for any physician or advanced practitioner or clinician who's taking care of individuals on their own journey with narcolepsy is please let your ego get out of the way in thinking that we can determine whether or not someone is severe enough. When you can choose to have option of the quality of life that you're living, then that's severe enough. If there is an opportunity to be able to introduce a medication that may make a meaningful difference, that is what we're treating to. When we're talking about children and adolescents, this is even more critically important. The choices we make as clinicians partnering with children and adolescents in their care journey has a lifelong impact. Don't allow for our thoughts of severity to steal away moments, days, or years from a child's life so that they don't achieve the academic success, the social experience, or the life that they want to live because we are inappropriately saying you're not sick enough to warrant a treatment that can be very effective. This is not just a specific endorsement of any one oxybate or any one medication. It is really the call to action of making sure that our own ignorance isn't preventing access for our patients to be able to live the best life that they can.